My name is Sam Lim. I'm a rheumatologist at Emory University. I became interested in lupus when I was in medical school in New York City. And it was in an inner city environment, and we had one of the world experts in lupus at that time at our institution. And she really got me interested in it by her first lecture, the fact that it's mostly women and minority women, and it's a chronic condition where you can get to know the people over time, over many years, and help them improve their quality of life was exactly the types of things that I was looking for. I came to Atlanta, and Grady was the natural choice for me. And we set up a lupus clinic at Grady, and it's really the only lupus clinic that I'm aware of that's dedicated in this way in the entire area. And it's something that we've been involved in for nearly 16 years.
Hello, my name is Cristina Drenkar. I am a rheumatologist and epidemiologist trained in Latin America. I am an assistant professor in the Division of Rheumatology of Emory University. Lupus captured my attention first, probably when I was in the 4th year of my medical school in Argentina. What really impacted me the most about lupus was the fact that it striking predominantly women, and so as I was in my early 20s, and it was really very impacting to me. I realized how important it is to provide individualized education, good care, and also to how important it is to have our own data, or would be to have our own data to respond to the needs of our patients. And that's why I started thinking more on how wonderful it would be for me to be part of the research in lupus.
Our pivotal studies that started a lot of this off in terms of research that we have here is the Georgia Lupus Registry. It was funded by the CDC. It was at a time when we knew very little in terms of good, solid scientific data about what happens with lupus in the general community. And we spent close to 8 or 9 years with thousands of person hours combing through charts and identifying people. And at the end of the day, we had one of the biggest groups of people identified with lupus in the world. And then from the Georgia Lupus Registry, since we identified all these people with lupus throughout our area, we had the permission to actually reach out to them and invite them to join us in a study where that they can get involved. And that's really the phase that we're in now. It's called the Georgians Organized Against Lupus study, or GOAL.
Our vision is eliminating health disparities in lupus. So we try to do our research with a lot of inputs from patients. We enroll patients from all over Atlanta, but a large population that we have is from the Grady Hospital. So we are very interested in learning more about how to really help people from minority groups to have better outcomes, and that's basically the main focus of our research.
The GOAL cohort, Georgians Organized Against Lupus, is designed to capture data concerned with healthcare access as well as characteristics involving mental health and physical health. This study generally asks people with lupus to complete surveys a few times a year, and these surveys can be completed by mail, web, or by telephone based on participant preference. This data allows us to learn and understand more about the daily challenges and the overall quality of life of people living with lupus throughout Georgia. And in return, each year, we develop a participant newsletter, and we're excited that we're in a process of developing a participant portal that allows participants to get more individualized feedback based on survey data collected throughout the years. We are hopeful that these reports, as well as with the newsletter, will be useful for participants to share with clinicians or caregivers if they wish, but more importantly, to provide them with tips to just improve overall quality of life. We thank you for your interest and invite you to learn more about our research projects by going to lupusingeorgia.org. And we thank you so much for your continued support of our research.
SOUL is one of our new initiatives, also known as Skin Outcomes Uncovered in Lupus. SOUL is looking at how skin lupus impacts the physical, emotional, financial, and all social aspects that have to do with having the disease.
My discoid lupus started with just a pimple on my nose. As soon as Dr. Sharp walked in the room, she said, "You have lupus." I didn't know what lupus was, but it sounded terrible. I've been to a lot of doctors, but they would always give me steroids, cortisone creams. I was getting facial injections. Nothing was calming my skin down. I wasn't so much bothered with the systemic at that time as much as I was with the skin and the scalp. I was in so much pain. I had just had a major surgery. I didn't know that my healing was going to be internal, that it was going to be my mind and my heart. And I think that's the day. I think that's when I accepted my disease. And that's when I decided to live and not die. I've always wanted to help people. This lupus has affected my skin, so I'm taking all those tools I learned from yesterday to use them for today and to reach out and help somebody else and allow the doctors and the study to learn more about this disease.
It's a very important study because there are a limited amount of studies that look at skin lupus. We ask you to commit 3 years to the study. It involves doing surveys, as well as biospecimen collections such as blood donations. And of course, we do compensate you for your time. We appreciate all your efforts and time that you would have to give up in order to be a part of the study. So if you should have any questions or if you'd like to join, please give us a call at 404-778-3037, or you can email us at info@lupusingeorgia.org.
Hi, my name is Bezoya Mandafro, and I work with the BWS team, that's short for the Be Well study. It's a new study that focuses exclusively on African American women with lupus. It is the first and only study of its kind that focuses on this demographic because we're trying to figure out what is the connection between race and gender. Why is it that African American women have the worst health outcomes with lupus? And so to be a part of our study, you must of course be an African American woman with lupus and also already be a part of our GOAL study. But once you are enrolled in our study, what we're going to do is we're going to work with you for the next 2 years. It will involve 3 in-person visits and 2 short surveys. Please give us a call at 404-778-3167. We're eager to hear from you.
I'm one of the coordinators of the PULSE study, People Understanding Lupus Through Shared Experiences. This study is focusing on cardiovascular disease. Heart disease is the #1 killer of lupus patients, and so we really wanted to understand the connection between lupus and heart disease. We're doing this in 2 different parts. The first part is through surveys. We want to capture some information about life experiences, past and present, and stressful situations and things that could be related to heart disease, as well as risk factors like diet and exercise or smoking. And so hopefully we can use this information to understand your risk of cardiovascular disease and then also understand how lupus could play a role in this. The second part of this study is we want to collect biospecimens, and these are things like blood and saliva samples. So if you donate these samples, we can use them to understand the genetic components and measure different hormones like stress hormones. To be a part of our PULSE study, you will have to be in our GOAL study already. And so once you're in the study, then we will contact you and see if you're interested in doing the surveys and also if you would like to donate some blood for our study. So if you're interested in being a part of this study, then feel free to give us a call, 404-251-8832. Thank you for partnering with us and helping us to understand more about lupus and especially understand the connection between lupus and heart disease.
My name is Carla. I'm a research nurse. I work at Emory. I'm with rheumatology and I work with clinical trials for lupus.
Hi, my name is Monica and I am a research coordinator and I also work on clinical trials in the Department of Rheumatology at Emory. The purpose of clinical trials is to learn more about the disease lupus and its manifestations and how it affects different populations.
Patients react to medications differently, so there's a lot of different side effects seen in different populations. So there needs to be a wide variety of patient populations. Some populations are underrepresented, so it's important to participate.
Patients can get involved with clinical trials by going to clinicaltrials.gov. They can also speak to their rheumatologist or reach out to the LFA.
Thank you for spending this time to watch this video and learning more about us. We hope that you have learned a little bit about our research projects, but I also hope that you've learned a little bit about our research team. Each one of us has the privilege of serving you all. And with every encounter, you have taught us about what is important to you, about the courage and the strength each one of you has. And that, in turn, drives us to work harder so that one day we can live in a world without lupus. So thank you.